Hi, I'm Dr. Robert Kaufmann, and it's time for us to go beyond the terminus. One of the most important roles that a clinician has, besides performing the actual treatment, is educating the patient. Patients are frequently referred to my office by simply being told by their dentist that they need a root canal procedure. They're given my card, or an appointment is scheduled with me, and then they're dismissed. In some cases, they're also informed that they will need to return to the dentist's office for reconstruction, such as with the crown. However, patients are rarely told about the specifics of the procedure and the consequences of endodontic treatment. I estimate that roughly 80% of the patients who arrive in my office don't understand that endodontic treatment does not protect the tooth against decay. They will never again have a toothache associated with the pulp because it's removed during treatment. But the restoration that's placed over the tooth is still susceptible to decay that can eventually cause the endodontics to fail due to loss of the seal, or worse, loss of the entire tooth due to decay that's not perceptible by the patient. We reinforce the idea that while the reconstruction of the tooth will return to full form and function, restorations such as crowns have a limited lifespan and must be checked by their dentist for defects or decay at each checkup appointment. Unless they've been treated previously, most patients lack an understanding of tooth anatomy, the pathologic process, and the specifics of the treatment. The consultation should include a discussion of the signs and symptoms and how they relate to the tooth anatomy in a way that the patient can understand. The explanation should be simple and include illustrations of the tooth anatomy and the reasons why this particular tooth needs treatment. In situations where the tooth is asymptomatic, or perhaps it had symptoms in the past, explaining the pathology process places the current clinical situation in perspective. This not only assists the patient's comprehension, but in many cases can explain, for example, why diagnosis or treatment may have been difficult for the referring dentist, or why the patient requires treatment even though symptoms may have abated. For many patients, these explanations do not only relieve some of the mystery about this misunderstood treatment, but they can assist in relieving some of the anxiety associated with the procedure. Patients who understand the steps involved tend to be less nervous and can better appreciate the stages of treatment and better value the skills required to perform it properly. One of the most effective tools in my practice is the Brown and Herbranson EHuman 3D Atlas. This 3D imaging software can show the patient examples of similar teeth to the tooth being treated. Explaining the tooth in 3D allows us to illustrate the challenges and complexities of endodontic treatment, while at the same time making it easier for the patient to relate to the radiographic images that we've just taken. It gives patients a greater appreciation for the anatomic variations of each individual case and is invaluable in explaining why retreatment is sometimes necessary, especially when the 2D radiographic images may not show this clearly. Using the 3D Atlas images as a primer also allows us to then review any CBCT images in a way that the patients can better understand. Patients can then visualize the case better and gain greater awareness of the complexity of the anatomy and the skills necessary to treat it. This is especially important with retreatment cases where the patient may have had recent treatment by the referring dentist, but symptoms have persisted due to missed anatomy or inadequate endodontic treatment. Use of the Atlas helps to create value in the mind of the patient. It can also reinforce the need for any postoperative restorations planned by the referring dentist. We use it on each and every case as part of the case presentation, and it is an invaluable tool in helping us obtaining informed consent. The current version of the Atlas is version 9. The Atlas is available in two forms, the first being a downloadable program that you get off the internet that is licensed to be installed on a single computer. A second type of program is available for an annual fee, which allows you to online access to that program with an individual computer. Two different varieties of the Atlas are available, which include the full Atlas, as well as the less expensive hygiene module, which may be more financially attractive for those who don't want all the features associated with the more comprehensive Atlas. Regardless of which you choose, I believe that you will find it a useful tool for you and your staff when discussing diagnosis and case presentation with your patients, not only for endodontics, but also many other aspects of dentistry. Check out EHuman.com for further details. Remember, when we do the right thing, we both get better, patients and clinicians. Thank you for watching. Don't forget to like and subscribe, and I look forward to our next trip when we go beyond the terminus. See you then.